My name is Janel Redman, and I live in Portland, Maine, with my husband and my 2-year-old daughter and our 9-year-old golden retriever. And I completed my MPH in August of 2013. My undergraduate background came from Bates College in Lewiston, Maine, where I got a Bachelor of Arts in Japanese. And I am currently at home with my daughter. So I'm not currently out in the workforce, but I'm doing an important job. Okay, so for my practical experience, I worked with the Maine CDC, the Center for Disease Control and Prevention, specifically with the infectious disease epidemiology team. It was a position that I had heard about through the practical experience advisor at the time, and I felt that the fit was going to work well with me, and did some research on the area that was happening. And I was actually paired with a preceptor who specifically worked with foodborne and waterborne illnesses. And as I was looking at doing the practical experience and the capstone project at the same time, I looked into what sort of projects were going to be available for me to work with this preceptor on. And there were projects that could match and would be able to be used, where I would be able to do some of the work with the practical experience, and it would carry over into the capstone project. So specifically, one of the projects that was available to work on throughout my internship over the summer was an evaluation piece of an educational campaign that they had done at the CDC earlier in the year. So in March, the infectious disease epi team sent out educational materials to feed stores in the state of Maine who sell baby poultry. And the educational materials were designed to be given to the customers who were buying the baby poultry on how to safely handle baby poultry and avoid salmonella infection. So the aim was to decrease the number of salmonellosis cases in the state of Maine through this baby poultry buying and handling season as they were growing. And so nationally, these numbers were starting to rise a bit. When you look at the number of salmonella infection cases that are related to the handling of animals, poultry, versus those that are coming from contaminated food, it's a pretty small amount. But the number was rising, so it became an issue that was important to address. And it was something that, with these educational materials, if they were being used properly, was a pretty inexpensive approach to a way to address it. So what they had asked me to do was to create this evaluation and contact feed store managers and determine, were they using the materials, did they find them effective, did they use them at all, did they throw them out, and how they might have been using them throughout the different stores. So the CDC could determine, is it even worth sending these materials? Is anyone using them? Is it just a waste of money? Is it not? So this was the project that I was charged with, and I decided it was going to be a great fit for something that would also work well with my capstone. And I could look at more on the literature side for the capstone project, which was something I didn't need to do for the practical experience, but I was able to look a little bit deeper into the background, the history, how big of a public health problem was this, which was interesting because this is when I was approached with a fairly big obstacle, in that I learned it wasn't a huge public health problem, but it was a public health problem, and it touched upon some other issues in how consumers are taking recommendations such as washing hands and what that becomes, and how do you really share something like that, and how do you teach someone to really properly wash your hands. So it became this fairly big project that I had to kind of narrow down my approach in terms of what I was specifically looking at. So I felt like it was going to be a good challenge. It was certainly nothing like our diabetes or some of our obesity issues and how much research has already been done in those. But I felt like it was going to be a good challenge for me and a pretty exciting little way to go through the steps of this practical experience, of this capstone project requirements, and get the information I needed to create this final product. So a few takeaways that I had from this project, and specifically some skills that I think I really had to practice and that were skills that I had learned throughout the public health education and also in other pieces of my life, but that I actually had to put into use and I found really challenging. One was the part of the project that I had to do is I had to actually do phone interviews. So I had to call the feed store managers, get their attention, get their time, and ask them to complete a 10-minute survey that I had created. And when I had created the survey, I went in pretty narrow-minded, thinking this is going to be so easy. I'm going to get all 36 feed store managers to give me their time. This is going to be a piece of cake to collect this data. And I was just blown away by people saying that they could not talk to me, they would not talk to me, they didn't have time, they were working with customers. I wasn't paying attention to what situation they were in as I was calling, just sitting at a desk in air conditioning without any problem and no time constraints. So I was really faced with this challenge of trying to be creative in how I could get managers' attentions, how I could get their time. I tried every manager 1 to 3 times, but I had a really hard time collecting this data, and I was only able to, in the end, get information from 18 of the managers, which was half, which was a lot, but also, when I started the project, way less than I thought I would have. So that was an interesting challenge of just having those phone conversations, having this job of collecting data in a situation where I had to get it. I was the only one. I couldn't have anyone help me. I had to do this and I had to collect it. So I was definitely just very challenged with being creative and how to figure out how to get the information I needed to continue with this project. The second piece of the project that I found that was a really gained skill that I got a lot of help with from my preceptor was writing my final report. So I was writing a report, I was writing 2 reports because I was writing a report for the Maine CDC, and that was a very scientific report, exactly how they wanted it and exactly how they felt public health reports should be written. And then I was also writing the capstone project, which was slightly different in that it included the literature review, it included a little more background information that it wasn't as necessary in the report for the Maine CDC. So I was sort of balancing these 2 reports, but also just learning a lot on how to write and language I needed to use. And while there were certainly a lot of papers during the courses I was taking in public health during the time of my MPH, this was a very challenging paper for me, as I didn't ever write one quite that long from start to finish. With all of those aspects together. And so I really learned a lot about language, proper language to use, and how to make things short, sweet, to the point, and take out the fluff that I had a little bit of in the capstone project, but then removed. So those writing skills and those customer service skills or the communication skills on how to work with people definitely were big takeaways for me. I guess another challenge that I had with looking at starting the practical experience and the capstone project at the same time is that I felt like it was this gigantic project with an end product required that I wasn't going to be able to accomplish. Looking at the syllabus for the capstone project, I felt actually quite overwhelmed in that I didn't know how I was going to get from this little idea to this large end product, and with a paper and a presentation. I was very overwhelmed. But then I tried to step back and just look at the project on a smaller basis, so a step-by-step basis based on little assignments. So starting first was just working on a proposal, and just making a proposal that was really strong and precise helped me realize how I was going to get to the next step. And then doing my literature review and realizing, okay, this is how I'm starting to really form this. So I think that the way that it's laid out is guiding students really well, and I couldn't have imagined I would have gotten to the end product. And I found this with some of my other courses too. Sometimes I felt very overwhelmed by the large paper at the end or a large presentation, and then you just have to go through it little by little and realize that it's just week by week or step by step and getting through that little bit, and then you can really have the successful end piece that's really exciting and you can feel quite accomplished about it. So my experience with the UNE MPH program was great. It was wonderful. The online format was perfect for me. I was working full time, so the way the classes were laid out gave me the opportunity to do the work when I had time to do it, but it was also very structured, and so I couldn't get too far behind. I couldn't get too far ahead, but I was able to really balance my work, my job, I was really able to balance my work, my home, my family, my friends, and this education educational side. And I think that for the network of students that I met through the computer and sometimes face-to-face if I had opportunities, was really vast and really an interesting group from various backgrounds. So some have public health backgrounds, some didn't have public health backgrounds, some had different business backgrounds, or some were younger students, some were older students. It was just a very good variety that I felt like I created this really strong network. And the discussions within each course, because of that wide group of people that were in the courses, was very rich to me. I felt like there were a lot of different opinions from different sides and from different experiences. So I think that was really valuable, and certainly something that was a big takeaway for me. Yeah, so I'm hoping to get into the public health workforce, into a position. I part of the reason I chose my practical experience at the Maine CDC was because I really wanted to get an overview of what public health looked like at the state level. I felt like that was important because I knew that my goals for myself, I find myself fitting in more in a position that's at a community level or a city level. But I felt like it was really important to understand what goes on at the state level and how it operates. So that was a big reason for me of choosing my practical experience with the Maine CDC. But as looking for positions in public health, I do find myself looking for something that's more at a city or town level, community level. And I'd love to get involved with something that is related to a prevention program or a nonprofit that specifically is working towards a piece of public health where we're looking to educate and work on prevention, and some role that I could play there and making a big difference. Have my eyes open, and we'll see what I can find. My entire experience with my MPH was wonderful. Every class that I took I found to be my new favorite class, so I always looked forward to the next subject, the next class, the next challenge. All of the students that I was able to take classes with, I really enjoyed learning next to, and the faculty I felt were very knowledgeable in their areas, and I didn't think that we could have had a more structured program and something that met the goals that I had in mind, and it really did surpass them. It exceeded my expectations, absolutely. And I think overall it was a wonderful, wonderful experience that I'd highly recommend for anyone interested in the field of public health.